Hello everybody. I'm late again, I'm sorry. Starting next week I will try to be careful about my time management. So I'm sorry I keep you guys waiting, talking Turkish, and you don't even understand, most of you anyway. So okay, let's start promptly. This week I want to talk about a little bit triglycerides too. You know, in the blood panel there is this triglyceride, not always LDL, you know, like bad cholesterol and HDL and total cholesterol. So there is this triglycerides numbers. You know, patients ask, well, what is this triglycerides so high like that? So in the blood panel, when we check it, there is this triglyceride as well. Triglycerides are basically fat, okay? When we don't use the calories from the food we eat, the intestines send them to the fat tissues via blood for storage, okay, for future use. So when we have too much of the food, like too much triglycerides, they get stored in the areas that we don't want them. For example, liver. It causes fatty liver disease. It causes liver damage. Pancreatitis, that's a very dangerous condition. Elevated triglycerides cause cardiometabolic syndrome. So in the long run, it starts even affecting our arteries and the heart. So they are as dangerous as LDL in terms of building plaques. So we need to really try to lower triglycerides. That's why it's very important to get our numbers checked at least every 6 months, especially if it's high, every 3 months. So cholesterol panel is very important. So what causes high triglycerides? Insulin resistance. If insulin resistance is high, it causes triglyceride buildup. If too much triglyceride, it causes insulin resistance. So it's like chicken and egg situation. One causes the other. So alcohol is liquid calories, right? So we don't want them. It's triglycerides and causes fatty liver disease. Hypothyroidism. With hypothyroid people, the metabolism is very slow. So they are not really able to process the triglycerides very well. Inactivity, because we're not burning the fat we're eating, right? The calories. If you consume too much calories, then we expand. So expand, it means that it's going to get built up. Obesity, processed food. A lot of people, even the people who don't eat meat, like vegetarians, for example, if they consume processed carbs, that's triglycerides. That's why they say, I don't even eat meat. Why are my triglycerides high? So that's the reason. Okay, so, and you know, fructose, for example, from sugary drinks, that's really bad too. So some medications cause high triglycerides. These are diuretics, beta blockers. They also lower HDL. So as you see, some of the medications we're taking to help with our heart health, you know, metabolic health, they even cause triglycerides. So, like simply what we can do to reduce the triglycerides is omega-3. Flaxseed, for example, chia seeds, walnuts. Exercise lowers it because exercise, our muscles use the triglycerides. Leg muscles, for example, largest group of muscles in our body, right? And there is this enzyme in it. It's called lipoprotein lipase enzyme. So that enzyme gets activated, and we burn the triglycerides there. Okay, and exercise also makes HDL go up. So that's another reason to do exercise, because it clears our arteries from LDL and triglycerides, right? So we need to reverse the insulin resistance. We need to reverse the control the blood glucose, 15 kilogram weight loss, 33 pounds. This 33-pound weight loss, why do we keep saying this? Because the studies show that the most potent lifestyle change in the studies to reverse the metabolic syndrome is 33-pound weight loss. But if you're not overweight, don't worry about it. But we did talk about the waist size as well, right? 80 centimeter, under 80 centimeter in woman, 94 centimeter in man, right? So 35 inches in woman, 40 inches in man. So we need to fix the metabolic disease. Okay, so some medications they use for it, even like metformin, because remember insulin resistance also cause high triglycerides, so we're trying to reverse the insulin resistance, a little bit sensitivity with metformin so that triglycerides don't rise much. Statin, fibrates, they use it to reduce the triglycerides. Lipitor, Crestor, for example. Fibrates, niacin is the vitamin B3. So these medications, I don't really start these medications unless there is a problem with statins. Patients may not be able to take because of the side effects. So my main, what I prefer is lifestyle changes. If the patient is not able to change the lifestyles, if they are dependent on other people or something, I do start statins, but otherwise lifestyle changes. We at least 3-6 months we start the lifestyle changes. If it's not working, we start medications. Okay, so other medications to reduce the triglycerides like lipoprotein lipase, gene therapy, olezarsen. These are the medications, as I told you, I don't really start them. I leave it to the cardiologist. Okay, we say that the largest group of muscles are leg muscles, and there are lipoprotein lipase enzyme get activated in the leg muscles. It means that we are created. We are meant to walk. Okay, so please go for a walk every day. Okay, so let's talk about general cholesterol now. How to reduce, what are our strategies to reduce cholesterol so that it doesn't cause plaque buildup and it doesn't threaten our life with heart attack and stroke, right? I'm having some connection issues. There's some storm going on here where we live, so hopefully I won't lose the connection. Okay, so cholesterol in total, so when you see the cholesterol numbers in your cholesterol panel, there is total cholesterol on the top, right? So that should not exceed 200 milligram deciliter. So that one is combination of the other cholesterols. So American Heart Association recommends not exceeding more than 200 milligram of cholesterol intake from the food if we have high cholesterol. So what's the 200 milligram? One large egg. One egg is 200. So if you ate one egg a day, then you can't eat another animal product, because too much cholesterol in red meat, too much, even chicken breast, there's cholesterol there, right? So cheese and all the milk, all the other animal products. So the reason like 200 milligram, they're reducing, it's just like too much, because we make our own cholesterol too. Remember, 1 gram of cholesterol we need, we have 1 gram cholesterol production in our liver and our tissues, right? So that's why we don't need the cholesterol from outside. When we eat from outside, you see, it's just like the problem. So when you have heart disease, too much cholesterol, you cannot take more than 1 egg a day. That's about it. So LDL is bad cholesterol dedik. But if LDL is normal, but HDL is low, good cholesterol is low, that's itself is a risk. It increases the risk of cardiac event or stroke more than double. So we need to keep our good cholesterol in good numbers, like above 40. And remember, we talked about triglycerides. They are even more dangerous than LDLs in terms of stickiness and, plaque buildup, causing plaque buildup. So if triglycerides are high and LDL is normal, 73 times more risk of death from the plaque buildup. So that's why metabolic health is important. Triglycerides means metabolic. HDL, low HDL means good cholesterol. If it's low, means cardiometabolic problem. Okay, plaque formation takes years. It doesn't happen overnight. Okay, that's why we need to even start feeding our kids healthy so that they don't have this problem in the future, right? It takes decades to build up plaque, to build up in our arteries. So as you know, I mentioned last week, there are soft plaques and hard plaques. Those soft plaques are more dangerous because with high blood pressure they may just get ruptured and then travel and cause heart attack or brain like stroke and heart attack. So it may cause danger with those little blood clots that's clogging the main arteries. Okay, heart attack is the #1 cause of death in the United States. I think in many countries, I think it's in the world. So, and cholesterol drugs are prescribed to prevent these heart attacks and stroke, right? So that's #1 prescribed medication, cholesterol medications. These are statins, okay? #1 best-selling pharmaceutical group. Revenue yearly $20 billion. So, but at the same time, these cholesterol drugs called statins are very controversial because studies did not show too much efficacy, and also they have a lot of side effects. That's why even though every doctor hates the medicine, we're having to prescribe it. Okay, so let's talk about these statins, controversial statins. So in 1973, Japanese biochemist Akira Endo discovered a connection between mushroom poison and cholesterol synthesis. And he developed the first studying group of drug with the theory that it would lower cholesterol. Since this drug was not found to be safe in the first studies, FDA did not approve it in those years. So they worked on the safety profile of this medication over the 14 more years, and in 1987 finally FDA approved this medication for cholesterol lowering agent. So one other reason is just there is no other solution to lower the cholesterol. That's why it's like our life jacket. So when we have too much high cholesterol with a patient, they have other comorbidities, or especially if the patient already has an event, had cardiac event or stroke, we have to even though there are a lot of side effects. Okay, so statins lower circulating cholesterol in the blood by inhibiting an enzyme in the liver that produces cholesterol and increasing the reuptake of cholesterol from the blood into the liver. So basically, it sweeps the cholesterol in the blood, and liver takes it more, and then dumps it with bile and our intestines and colon. So basically the goal is lowering the LDL under 70 so that they don't cause traffic jam in the arteries and doesn't cause plaque buildup. So that's the main goal. So yes, statins reduce circulating LDL, we said, around like 30-50%. And also they help reduce the inflammation in the blood vessels, and also they cover soft plaques with calcium and make soft plaques hard plaques. So basically trying to stabilize the plaques from rupturing. Okay, so if the patient's cholesterol is high, we're starting. One way of decision in terms of starting the cholesterol medication statins is Framingham risk scale. So I shared this scale in the last week's live in the comment section. So you can calculate your own risk to see if you need statin or not. So for that one, you need to have your lipid profile in your hand, right? So because you need to put your total cholesterol, triglyceride numbers, LDL, HDL, and also you need to put if you smoke, if you have diabetes, high blood pressure, you need to put all those numbers to be able to calculate your risk. It's different for man and woman. Okay. So let's go. And some doctors also want to see if these patients have calcium, coronary artery calcium score, right? So that's the most valuable test actually, because with the cholesterol test, we're testing only the cholesterol that's traveling in our blood. We don't know if there are actual plaques, because some people have high cholesterol but there is no plaque buildup because they have good clearing system, and some people have low cholesterol, especially if it's reduced by statins, but there's also plaque buildup. So it doesn't always give the correct diagnosis. It doesn't reduce the risk by itself, just lowering the cholesterol. Okay. Okay, so let's look at some studies about statins. Okay, here. So, according to the absolute risk reduction, okay, all statin studies conducted since 1987, since the launch of statins, the risk of death was reduced only 0.8. Reduced heart attack risk is only 1.3%. And reduced risk of stroke is only 0.4. As you see, these numbers are very small, like almost like zero. So by giving statin, you're not actually really helping the patients live long or having cardiac event. But even though the numbers are small, when you apply it to like, large populations, millions of people, it's still, even if you're saving one life, I guess it's worth it. So what I'm trying to say is just don't rely only on statin drugs, right? Okay, so another 11 separate studies that's done with the 90,000 people who already had heart attack or stroke before, and these patients lived only 4 days longer compared to non-statin group. So yeah, it's just making you live only 4 days longer, if you have statin on board. So again, who's gonna take that risk? We just have to give this statin to these patients, because there is no other drug that we can lower the cholesterol. Patients need to do lifestyle changes. That's it. If they want to live long, they have to do lifestyle changes. If they were doing, like exercise and eating well, they wouldn't have this problem anyway. Okay, so let's talk about this widowmaker artery a little bit. This is the one coronary artery, largest one. There are 4 coronary arteries, right, that feeds our heart. So coronary artery calcium score is very important to detect if there is any plaque in those arteries, right? They are feeding our heart. So coronary calcium score is important. That's widowmaker especially. That's the one on the front, left, LAD. That one is called widowmaker, because once that is clogged, that's the death. Okay, so it's very important that you get your calcium score done and it's 0. Okay, no more than 1. So yeah, you don't want any, you want 0 plaque in your arteries, right? Okay, so we said we shouldn't focus only lowering LDL. Triglycerides are important too. They are actually even more dangerous to cause more plaque buildup. So please, you need to increase HDL too. You just need to be metabolically healthy, okay? You need to quit smoking, quit alcohol, try to regulate your blood pressure, regulate your blood sugar, okay? It's just not okay, 1 LDL bad cholesterol. No, you see all those things surrounding that's causing this storm, okay? Okay. What else? So, as we said, if you have an event, or if your heart attack risk with that Framingham scale, if you calculate your risk, if it is more than 7.5% of having heart attack in the next 10 years, okay, we have to give these medications, right? So we don't really take risks. So, but we just give 3 to 6 months for these patients to apply the lifestyle changes, okay? So even if your doctor didn't mention, maybe you should mention, doctor, I want to try this lifestyle changes before I start these medications. So there are a lot of side effects. So let's go over the side effects a little bit. So what are the side effects? Why is it so controversial? Because muscle damage, elderly people, usually the people who are using this, let's say over 40, over 50. So these people already having sarcopenia, they are losing muscles. We don't want these people suffering from muscle aches. When they have muscle aches, they don't even want to go for a walk. So that's why it's dangerous. Okay, some doctors even started giving CoQ10 because, you know, that's how statins cause side effects. So they're also lowering CoQ10 enzyme. So muscles need CoQ10. So that's why some doctors started giving CoQ10 together with the statins to combat the side effect. And it causes brain fog. A lot of people cannot take it because of the forgetfulness. So, you know, it reduces the cholesterol that goes to your brain, and your brain uses cholesterol. So, you know, when you don't have enough cholesterol, then you start forgetting things. Okay? And it makes you develop insulin resistance. So, you may even get diabetes because of statin. A lot of people got diabetes because of statin. Who wants that? So you're trying to fix something, something else is getting broken. So, okay, liver inflammation. If patients have fatty liver or their liver enzymes are high, I don't prescribe statin. I can't. I just send them to cardiology to start another agent because, you know, it causes liver damage already. So, and then when a patient is having a fatty liver, you can't really give this medication. It's not safe. Okay, kidney damage. It may even poison the kidneys. If patients are having blood in their urine all the time, we stop these medications. Okay, it also reduces male hormone testosterone. If some patients started having erectile dysfunction on these medications, we have to stop, unfortunately. Okay, what's the solution then? In my opinion, the biggest side effect of these medications, it doesn't matter cholesterol medication, it doesn't matter blood pressure or diabetes medication, the side effect is mind shift. They start thinking that, okay, I'm taking the medications, I don't need to change anything. So they start expecting everything from the medication. That's the main side effect, in my opinion. So we gotta do something. We gotta do the work. Okay? The human body is incredible. You give one, you take million back. Okay? Very rewarding. Do the work. You go for a walk, unbelievable. Like, you know, this lipoprotein lipase enzyme in our legs means we are meant to walk. We are created to walk. So that's how we utilize the triglycerides. That's how we utilize the, you know, cholesterol. So at least walk. You don't need to go to the gym. You don't need to lift the weights. I mean, it would be good if you lift the weights, but at least go for a walk. Okay? So diet. We're talking about diet so much because the fiber is going to wrap the cholesterol around and like a cocoon and let it out from our bowels, intestines and bowels with the help of the gallbladder, right? So diet is very important, and you can add some healthy other supplements too. What are those? One, berberine. Berberine helps with blood sugar regulation as well. Amla powder. Amla powder, Indian gooseberry, is the most potent antioxidant in the world known to human. Okay, so get the powder, get the supplement, you know, in a capsule or however you can help with that. Instead of taking statin, just do this. Another one, citrus bergamot. So the studies are very confident about berberine, amla powder, citrus bergamot in terms of lowering the cholesterol. So statin, of course, you have to take it. You know, you always need to talk to your doctor. Don't just stop your statin just because we talked here. But the first 3 months, we give the lifestyle changes as like, we giving you a chance to fix this by yourself. Just, you can incorporate these supplements as well. And if you can prevent using statin and prevent future cardiac events and, stroke, it's just like, isn't that great? Just focus on your healing, okay? It's worth it. So do not eat processed food. If you don't eat processed food, it means that's, you earned the, you got the half of the battle. No fried and trans fats, okay? Some other medications, ezetimibe, bile acid sequestrants, PCSK9 inhibitors, niacin. I don't really give these medications. If the patient is metabolically not healthy, things are not going well, cholesterol keeps going up, and patient cannot take statin because of those side effects I listed earlier, then I send the patient to cardiology. Maybe they start this. But omega-3 fatty acids, I just, tell the patient to take flaxseed. But, when I send the patients to cardiology, they start this omega-3 prescription strength. It's just very highly concentrated fish oil, I think. They give that too. Okay, so please do not stop your cholesterol medications or change anything before talking to your doctor, okay? If you have side effects, you go right away and talk to your doctor, okay? As I mentioned earlier, you may take CoQ10 to prevent, or relieve the side effects of muscle pains. Okay, intermittent fasting is very potent way of reducing LDL and triglycerides, right? Because those are food. You said you were going to eat later, you stored it, but you never eat it, okay? You keep eating from outside. You never use your internal sources, right? It keeps accumulating inside and then, causing all this trouble, right? So when you don't eat 14, 16 hours later, you start eating those. So you're eating your plaques away. So isn't that great? Just, by just not eating. And intermittent fasting, it doesn't have to be that hard. Even like 16 hours, if you can do regular every day, it's just like you're done. You're already doing it for your longevity and everything to prevent diseases, not only heart disease, all the other diseases too. Okay, so we'll talk about it next week. We'll talk about intermittent fasting because we're trying to do intermittent fasting as a New Year resolution in January. So we're going to do this as a group, all the people who want to join. So I'm gonna give information next couple of weeks about that. Okay. Remember, we also want to keep our arteries healthy, not only reduce the cholesterol, keep the arteries like fortress so that, nothing can stick to it. It's like Teflon pan, right? What makes our arteries healthy? We mentioned in the previous weeks, no smoking, no alcohol, keep the blood sugar under control, blood pressure under control, and nitric oxide. You remember I talked about these nitrates that we make nitric oxide from in our body to keep our arteries healthy. Those are green. All the vegetables, but mainly greens and beets, okay? So let's keep our arteries healthy. Okay, and also, omega-3s, walnuts and things. So, okay, I'm about to finish. Again, it took too long, but there were some questions. They sent their lipid profiles to patients, one in Facebook, one in YouTube. So, one of the patients, he sent his numbers as millimole, but I converted to milligram. Is triglycerides are okay, HDL 0.82 was the millimole, HDL 142. Remember, if they are close to each other, it's not problem. Triglyceride and HDL needs to be close to each other. We don't want triglycerides more than 3 times of HDL. Okay? So, okay, Muda, your number is good. 0.82 triglyceride and HDL 1.42. It's almost close to each other. Okay, another patient from Turkey on YouTube. His cholesterol is 256, LDL 179. LDL 179 is too high. HDL is okay. Triglycerides here is almost 150. It's okay, let's say. It's better if it's closer to 100, but you know, still in the normal range. HDL triglyceride ratio is almost 3 times. We prefer to more like 1 to 1. Okay, so yeah. So LDL being 179 is too high. It needs to be no more than 100. Okay, so we're finishing off today. I'll go to work. Please ask your questions in the comment section. When I come back from work, I'll answer those. I'll see you next week with the topic of intermittent fasting, okay? Bye for now. See you next week.